Post traumatic stress disorder, also called PTSD, happens when some memory of a past traumatic event, like war or sexual assault, causes recurrent mental and physical distress. Now, the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM 5, categorizes PTSD as a trauma and stressor related disorder. That happens when symptoms of an acute stress response persist for over a month. The main symptoms are psychological ones. For example, someone might re experience their trauma through nightmares, flashbacks, and intrusive thoughts. But these can lead to behavioral changes as well. Somebody might start to avoid environments and situations that remind them of their trauma and feel a sense of hypervigilance, where they're constantly on guard, or hyperarousal, where they have this exaggerated startle response to the smallest of triggers. Not surprisingly, all these thoughts and behaviors can lead to trouble sleeping and general irritability, which can lead to angry outbursts. Treatment for PTSD can be kind of complicated, since people with the disorder are often reluctant to engage with the trauma in any way, in their thoughts, their emotions, or in their conversations, which can make treatment really hard. Research has shown that exposure therapy, which slowly exposes individuals to situations that cue recall of the trauma, can be very effective. Group therapy is also a popular choice for people with PTSD because it provides survivors with a safe place to relive their trauma in a supportive environment. In terms of medications, antidepressants, in particular selective serotonin reuptake inhibitors or SSRIs, can help to reduce depressive symptoms that often accompany PTSD and can help minimize flashbacks and nightmares. Anti anxiety medications can help decrease the heightened physiological arousal often seen in people with PTSD. And finally, sleep aids can be helpful because lack of sleep and restlessness is such a serious problem with PTSD. In addition to this, a lot of people with PTSD self medicate with alcohol and other substances, which can actually worsen their symptoms and their overall health.